I'm Dr. Shetlin. I want to welcome you to Kids and Car Crashes, the Pediatric Conundrum. And I want to address the most important and valuable assets in our cars, which are our children. And when we're in a motor vehicle collision, whether it's a high-speed or low-speed collision, there are a lot of physical forces at play and a lot of research in this field. And as parents, we just don't know what we don't know. And so today I hope to take you through a quick run on how important it is to have our kids properly checked after a car accident, whether it's a fender bender or something big, and make sure that they see a certified motor vehicle collision specialist physician or pediatric specialist physician like a chiropractic pediatrician. And we'll deep dive into this today, and I hope you enjoy it. We're going to make this as fast and fun as we can on a very important topic. So today we're going to cover simple physics, how they apply the same to adults as they do for kids, the mechanism of injury, the physical forces applied through a vehicle into us, the occupants, the research that's out there from the 1950s to current for adults, applying these physical forces and the injuries that take place to us adults, and the pediatric research, which is very hard to find. So I hope you appreciate this presentation. So just so you know about me, it's easier to learn from a presenter when you know a little bit about that presenter. My name is Dr. Shetlin. I've authored quite a few books on health and wellness, and especially I have 3 specific books on personal injury, car accident injuries, and I train doctors and attorneys across the country in this topic. So let's go through some statistics. This is very important information. There's 1.5 million crashes just in the U.S. per year. That's 4 during this lecture, maybe even a few more. Out of all those personal injury cases, half of people involved have long-term problems. 10% are disabled. These are according to the Croft Research and the San Diego Spinal Research Institute. Nationally, motor vehicle crashes are the leading cause of deaths for teenagers. Yikes. So we want to make sure that whether we walk away from the crash or it's serious, we get checked and rehabbed appropriately for our teenagers, for our young kids, for our newborns that are in car seats. And you'll understand all this clearly as we go through this today. So I want to go through the anatomy of an accident. I'm showing research from the San Diego Spinal Research Institute. This is a video where we're going to show what we as certified specialists call the bullet vehicle. The vehicle in motion is going to have a closing velocity, that's that VC, of 9.9 miles per hour as it rear ends the target vehicle, the vehicle that is stopped at a stop sign, for example, for the example of this study. And upon impact, the energy is going to transfer from the bullet vehicle to the target vehicle, and the target vehicle is going to instantly go from 0 to 6 miles an hour. That's called the change of velocity. And the head acceleration of the occupant in the target vehicle, the car being rear-ended, is going to be 13 Gs. And I want to emphasize the fighter pilot from Top Gun, if they experience 4 or 5 Gs, they're going to black out. Now, the new Hollywood movie, of course, takes it to like 9 Gs or 10 Gs or something because Hollywood loves to push the limits. But realistically, 4 or 5 Gs, we're going to black out because our heart can't pump the blood to our brain. And this gentleman's head in a low-speed collision under 10 miles an hour experiences 13 Gs, meaning his 10-pound bowling ball head weighs 13 times, 130 pounds, as it's moving in the opposite direction of his body or torso 3 times in a split second. So it's pretty crazy to see this. And as a certified specialist, I want to point out a couple things. This gentleman in the target vehicle, black sedan, actually has mass in his favor. Notice his head restraint is too low, which is a complicating factor, increasing injury. But because he's in a larger vehicle, being struck by a smaller vehicle, he should be in better shape. But when you're rear-ended, you have no way to brace. And he was injured and taken out of the study. You can see all the participants observing these studies back in 92, 93. There is no correlation in the research of damage to vehicle and injury to occupants. So sometimes we think, oh, there's not much damage to the vehicle, so we must be okay, or at least the insurance adjusters will play that game, and that's not how it works. More people, and I'm going to say this right, and you're going to think I said it wrong, more people are injured in low-speed collisions than in high-speed collisions. And there are reasons for that I will address. But I want you to look at this picture of the baby next to in the car seat. Now, imagine, let's watch this again, and imagine that this baby is in a rear facing car seat in the back of that sedan. So that's the equivalent of a front impact. You'll notice that the baby's head is a third of the size of the baby's entire physical body, and the torso is well buckled in, which leaves that head and neck exposed for experiencing extreme whipping forces. So kids do get injured in car accidents, but they may not be able to elicit or explain the symptoms. For a baby, maybe they're not latching on when they're nursing as well, they're tugging at their ear, they're not sleeping as well, they're more cranky. There are things that parents need to observe because they're not going to be able to communicate. So I want to talk about car seat safety for just a moment and show you how this works in the video here. We're taught to keep kids rear facing as long as possible. And that's because in a frontal impact, which is the most likely crash we're going to have, if we're rear facing, like we see over on the left, on the right, it distributes the forces evenly through the car seat, protecting the baby. But on the left, we see if they're front facing in a frontal collision, that is bad. That is exactly the same as if they're rear facing in a rear impact collision, which is very common. As a matter of fact, in our clinic, the most common things we see are rear impact collisions and side impact collisions. There's no way we can brace for a side impact or a rear impact collision. We are at the mercy of physics. And I know as human beings, we normally like to downplay that we're okay, but that doesn't mean we didn't sustain injuries. And these injuries cause joint instability and lead to degenerative changes in our spine, which can affect our health and our longevity, from organ function to hormone balance to digestion, immune system function, and of course, pain. If a nerve is pinched 80% or more, the research shows, then we feel pain. Now, there are anatomical reasons why kids and teenagers don't elicit the pain to the level of us adults, and we will address that here. But please understand that according to the AMA guidelines, these injuries are permanent. So we want to make sure we jump in early, get the right care early so we can minimize problems and strengthen and rehab the tissues as best as possible, not simply cover them up with Tylenol or things that help reduce inflammation for symptoms. So here, let's look at this picture as an example of this gentleman that was rear-ended in the black sedan. Now, this is an image of the neck, but it's unfortunately facing the wrong direction. It should be facing left, but we'll just use your imagination. So these are the spinous processes on the bones in the neck, the body of the bones in the neck, the anterior longitudinal ligament in the neck, the interspinous muscles in the neck. Well, when he was rear-ended from behind and whipped forward with his head restraint too low, it actually tore his anterior longitudinal ligament, which is invisible on X-ray. So we have to know how to work up, diagnose, or request the right imaging, which even sometimes on MRIs, these are also difficult to see, but we can nail this stuff down with the right workup and diagnosis. Then he whips forward, his seatbelt engages, stopping his torso while his head whips forward, and he tears posterior longitudinal ligaments possibly and interspinous muscles. These are, again, soft tissue injuries that we can't see on X-ray unless we're trained to do the right imaging, like flexion extension, overlay them, and do measurements so we can look for the gapping in the bones to see, and the joints to see how much movement is going on to see if there's too much. What this does is going to lead to a loss of that beautiful curve in the neck that we see on the left. This curve is so important in the human species that it's called the arc of life. And when we have that proper curve in the neck, our joints and our discs, which are our shock absorbers, you can see the blue smiley face there, are under the proper strains and can function biomechanically, like the shocks on your car. Driving your car without shocks is not fun. Walking or running without proper alignment in the spine causes microscopic, repetitive microtrauma that can lead to problems over time and degenerative changes. You can see the blue disc on the right with this loss of curve on the right, that straight green line. It's putting undue stress on our spinal cord and the blood vessels and blood flow to our brain, as the research is showing. And it's putting undue stress on the joints and ligaments where they will gradually start to become arthritic. Now you can see bony processes starting to grow. The corners are getting sharp and jagged rather than being rounded as they should. And this is a downstream effect. Totally preventable if we can get in early and take care of people and not wait till it's crisis management. Okay, so let's go over the adult research really quick. Low-speed ligament damages, according to Punjabi, they took 6 cadavers, put them in a car, tilted their heads slightly, and then crashed cars into them. And they discovered that at 8 Gs or 5-mile-an-hour change of velocity, we are pretty much guaranteed to have some sort of soft tissue injury, whether it's eliciting pain or not. And it's going to lead to a problem that's going to catch up with us later. Complicating factors for women. Female drivers are 3 times more likely to be injured than male drivers in a whiplash crash because of the amount of muscle mass that a man has as a neck compared to a woman. It's only 15% difference, but that makes up to 3 times more likely for an injury for women. So a man and a woman sitting in the same crash, exerting the same physical forces, sitting nice and straight, looking straight ahead, the woman is 3 times more likely to have injuries. So let's talk about the research with kids. And here's where it gets tricky. I showed you a video of a man sitting in a black sedan with a red Honda striking the man. So we could measure the physics applied to the human body, not a crash test dummy, in these tests. Interestingly enough, no one will put their kids into these studies. And can you blame them? So digging deep, what I found in the pediatric research is that the auto accident injury and death statistics overlay perfectly with another well-researched pediatric trauma genre. It is important to notice that pediatric research shows, according to Spine 2007, the most common cause of serious pediatric spinal trauma is motor vehicle incidents. 0 to 4 years of age has the highest proportion of serious injuries at 47% of the group. Yikes. This is where it's tough. Children who sustain minor injuries and are not brought to the hospital, or rather go see their general practitioner or other healthcare professionals, are not included in the sample. So they're not even counted in the data. Therefore, this data is way underrepresented for minor injuries. Meaning, we think, oh, our kid's okay, they're young, they're resilient, so we don't take them. So if they're just seeing their general pediatrician or seeing or they're not taken to the doctor, this information is completely underrepresented. The best comparative research that I've found is that auto accident spinal injuries for kids is comparing research to shaken baby syndrome. They are both an acceleration-deceleration injury, as the research shows. One is on purpose when someone who has lost their temper, the other is unexpected and in the vehicle. When you compare the research, the total number of spinal injuries caused and found in these studies were 30% classified as serious, 70% were classified as minor. This is again according to Spine 2007. The mortality, death, was as high as 30%. That's pretty serious. And 70% survived, but they suffered long-term impairment. So maybe they say, oh, that's not so serious because they survived. Interesting correlation on those two. Death and minor, death and survived but have long-term impairment. Anatomical features that make infants particularly vulnerable to acceleration-deceleration events are particularly that head size to the rest of their body and the weak musculature of the neck. It puts these kids at huge risk in the car. This is very important information to monitor. As I said earlier, the head's a third of the body size of a newborn, but even in our younger kids, even in our teenagers, they're just so susceptible to these injuries. And there's a big challenge with car accidents because it's a shear force rather than a compressive force like walking and running that we're designed for. We can only handle so much of that too. That's why we heard if we were to jump out of a 1 or 2 story building. But when we have a 3, 4, 5,000 pound vehicle suddenly shoving us to the side or shoving us from behind, instantly that transfer of energy creates a shear force through our spine and it is detrimental to all of us, even our kids, even if they're not showing symptoms. Now, here's why anatomically our kids may not present the symptoms. You can see on the left, the vertebral body of the spinal bone, size to the disc size is pretty much equal when we're born. And then as we grow, the bones get bigger and the discs do not. And so then as an adult, we have big vertebral bodies and a smaller disc space compared to our vertebral bodies. What that creates is less space in the adult for room for swelling, and swelling is what causes pain. So if we have swelling putting pressure on our spinal cord or on other nerves, now we're going to have pain elicited if that nerve is pinched 80% or more. But there's more room, more space in there for swelling before it's going to cause a pain or problem for a kid. It doesn't mean it didn't cause damage to the tissues. It just isn't eliciting the symptom in these kids as easy, which is why we still want to get kids checked even if they're acting like they're okay after a crash. When we delay or do faulty treatment, that leads to adhesions around the facets. In other words, early degenerative arthritis changes. This is from Spine on pediatric spinal injuries from 2007. This is all in there. This can affect later our lymph, our edema, cause fibrosis of the muscles, swelling that eventually these adhesions affect the nerves or the nerve root canals. This can result in faulty posture. There's just so many things that can go wrong if we don't be proactive and help these kids or even adults after a car accident. But this focus is on the kiddos because we don't want them to be suffering in their 20s and 30s from a crash that we thought they were okay, that they were in when they were kids. This is a really good example, a study from St. George in my practice, where we see on the left a very straight neck. You can see a line here where the curve should be and how straight her neck is. She came in for care. She was young. She was busy with school, college, and work. She's like, I just don't have time to follow the research guidelines for this care plan. A year later, she came back. I just can't handle anymore. The neck pain, the headaches. I got to do something. Unfortunately, waiting a year, her insurance that would have covered 100% of her care had she done it right after is now going to say, hey, you didn't do it. There's a gap in care now. So you're on your own. You have to pay for it. So she had to pay for her own care. The middle one is the same story, but a different patient 5 years later. She came in just like the first patient, said, oh, I just don't have time with school and work. Just can't do this right now. You can see her curve going the wrong direction. We came back 5 years later with migraines, radiating symptoms down her arm. She's like, I just can't take this anymore. I wish I would have done the care early. What do I got to do now? Well, now you have to pay for it yourself. Your auto insurance won't cover it. It's going to take at least a year, kind of like braces for your teeth, only for your spine. It's a problem at this point. The right one is interesting because you can see the curves going the wrong direction and there's actually arthritic change. The disc heights are shrinking. There's pokey corners instead of nice rounded corners in the middle part of the neck. This gal was in a car accident when she was 15. So what's interesting about all three of these cases, they're all 25 years old. One had a car accident when she was 24. The middle one had a car accident when she was 20. The right one had a car accident when she was 15. So she was just getting her license or her permit, excuse me, or she was just a passenger in the car. And parents are like, oh, you're young, you're resilient, you don't have any symptoms, we'll just let it go. 10 years later, she's got degenerative changes and reverse curve in her neck, which is going to take years off her life and life off her years. Completely preventable if we would have been in there early. So there are guidelines for how frequent and how long an adult or a child should be seen by a chiropractic physical therapy practitioner to help rehab these soft tissues. Now, oftentimes, emergency room doctors say, oh, it's just a soft tissue injury. There's no such thing as just a soft tissue injury, especially post motor vehicle collision, because everything in our body is soft tissue, including our brain, our blood vessels, our nervous system, our organs, everything but our bones. And when ligaments are damaged, that's a permanent impairment, as I mentioned earlier. So from 1993 to current, they're saying that people should be seen after a car accident 3 times a day sometimes if it's extreme injuries, and then 3 times a week. Start early. We already talked about that earlier. And 2 to 3 times a week for quite some time. Dr. Jackson is the most widely researched medical doctor in the personal injury and whiplash world. And she said daily for 1 to 2 weeks, then 3 times a week. They don't tell you how long. They just say you need to be frequent in the beginning. Other guidelines tell us for how long. Most of them are suggesting for 2 months up to 2 years, depending on the severity. So let me go over some of those guidelines. The Croft guidelines are the most widely used research guidelines particularly for neck injuries post-motor vehicle collision. They're over 35 years old. They're research-based. There's no ties to insurance or third-party payers. So it's not money-driven. It's patient care and rehab-driven. They're readily accepted in most U.S. states and several countries outside of the U.S. Utah was the first state to accept these guidelines as their state guidelines post-motor vehicle collision, which is pretty awesome. The guidelines are awesome because they have different types. Is it type 1, rear impact collision, type 2, side impact, type 3, frontal impact, or type 4, rollover, spin out, combined forces? What took place in the crash? Then we grade it 1 through 5. A 1 just says, hey, I was in a crash. I don't have any symptoms, but the research still allows for some care. When we start seeing symptoms, we're in the grade 2. We start having more neurological findings and more serious findings, we're in a grade 3. Disc involvement, grade 4. We need surgery, and then going back to physical therapy and chiropractic and massage afterwards is a grade 5. So there's different stages. Was it a fresh injury? Did we wait 2 weeks? Did we wait 4 months, which is a stage 3? Is it chronic now because we waited past a year, stage 4? What are the complicating factors? For example, a child where their head is a third their body size. A female versus a male in the car accident. Was the head turned? So it's pretty important to understand if we're looking at kids here, most children will at least fall into a grade 1. No limited range of motion, no ligament injury that we can detect on exam, no neurological findings. But it still allows for a couple weeks or months of care to prevent problems down the road. Grade 3 is by far the most common we see in adults. In kids, it's usually just a grade 1 or 2. Thank goodness. But there's treatment protocols for how long and how often. The grade 1 is typically no more than 10 weeks, no more than 21 visits. So most of the time for doctors who are following it right and doing the 3 times a week for the frequency. So typically you're doing a month at 3 times a week or 2 months for a kid. It's not extreme. But boy, does that help save them trouble in the future. This is just a flowchart showing that we're grading grade 1 through 5. And then when we get down to the grade 3s and 4s, that's when people are usually going to the ER or the medical place getting some anti-inflammatory drugs or muscle relaxers or going to the emergency room. But grade 1s and 2s, usually people are just thinking, oh, it's okay, or maybe seeing their pediatrician. But the research shows chiropractic, massage, physical therapy out the gates is the most powerful in the medical and physical treatment world to help minimize time and recovery, to help minimize future problems, and help maximize health and healing naturally. I just want to close with this. One of the most important things we should learn as a parent is what we are supposed to do by law with a car seat after a car crash. Obviously, the law says you're in a car crash, even a small one, you trash that car seat. But there is no law that says what we should do with that precious cargo within the car seat. May I encourage you as a parent and a physician specializing in this area, always get your precious cargo checked by a certified specialist.